knee arthritis exercises. Now at the clinic, we do treat knee arthritis and we use different types of injections, or therapy can also be used. Now, if you're at home and you want to do some exercises that pertain to knee arthritis, there are certain simple things that can be done. So when it comes to knee arthritis exercises, one of the purposes of the exercises are to strengthen the knee joint. So we're going to focus on some exercises that will strengthen the muscles that cross the knee joint. So let's start with the thigh muscle or the quadriceps. So what you can do, you can sit down at the edge of a table or your bed. It's best if your feet are hanging. If not, and they're on the floor, that's fine. You can still do the exercise. So to deal with the quadricep muscle, what we can do, in this position, you pull the foot up like this, and you extend the leg with the quadricep muscle. When it reaches the top, give it a bit of squeeze and a gentle downward movement. Again, pull the leg up like this, pull the foot up like that, up, squeeze the quadricep muscle, and bring it down slowly. Okay. What you don't want to do, you don't want to swing like this. Okay, that is not the exercise. This potentially can injure the ligaments of the knee. It's a slow, controlled, very deliberate movement. Foot up, squeeze, and bring down. Okay, so now the leg extension exercise that you were shown can be made a bit more difficult. As you get stronger and stronger, you want to add some weight to the leg extension. So what I've done here, I've added an ankle weight. This is a 2-pound ankle weight that you can get at any sports store. So you strap it onto the leg like that, and the principle is the same. Pull the foot up, come up slow and control, flex the quad, calm down. Relax, up again, flex, come down, control. So as you get stronger and stronger, you can add more and more weight. Sometimes they come as a set. You might get a pair of 2 pounds with a pair of 5 pounds. So as you get stronger, you can probably add only 5 pounds or attach 2 of the 2 pounds to make 4 pounds. But the whole idea here is a progressive overload. What you want to do is to add more and more weight, make it more and more difficult as you get stronger and stronger. If you don't add more weight, if you don't make it more difficult, then your progress will stagnate, and you really won't see any long-term progress. Okay, so for those of you who may not have the range of motion to do the full leg extension, you can modify the exercise with an exercise called quad sets. So you see, you lie down or sit down in this position here, put a bolster cushion under the knee like this. So now you have this angle right here, and pull the foot back again, and you extend. Tighten the quadricep muscle or the thigh muscle, come down, up. Really feel that tension here. I want you to tighten that muscle and come down. So again, for those of you who may have limited range of motion and unable to do the full leg extension, now you can modify it you can do a different exercise where you have a shorter range of motion for the knee to go through. And with time, as you get stronger and stronger, and you can progress to the full leg extension, hopefully. So in the picture of knee arthritis, what you may also have are some tight muscles in the quadriceps, hamstring, calves. So stretching is part of your rehabilitation for knee arthritis. So what you can do, you can take a bed sheet, fold it like this, loop it around the leg. Now you're going to lie down, and you're going to pull gently, getting a stretch in the calf muscle and the hamstring muscle. Okay, use pain as your gauge. Pull, pull. Well, you can do like you're climbing. Pull, pull, until you begin to feel that stretch. If you're feeling uncomfortable or you're not sure about something, I want you to stop. What you don't want to do is injure ligaments on the knee. But stretching can be helpful because the muscles may have gotten tight due to the lack of use of the muscles because of the arthritis. And then you hold that for about 30 seconds to a minute. What you don't want to do is bounce. You're not pulling, not bouncing the movement like this. No, hold it like constant tension. And when you're ready, gently let the leg go down. Gently, 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 and relax. So now we're going to stretch the quadricep muscle or the thigh muscle. So what you do, again, stabilize yourself, hold a bed or a table or a wall, very gently, bring the leg up if you can, grab here, pull, gently, gauge the pain on the knee. If you're feeling uncomfortable or you're not sure about something, then stop the movement, Feel the stretch on the quadricep muscle. What you don't want to do, you don't want to bounce. This here is not what you're doing. You're holding the leg in this position, 30 seconds to a minute. Feel the stretch and gently come down. Gently, gently relax. One of the next muscle we will target will be the hamstring muscle here, that's behind the legs. This will be a leg curl. So what you can do, you can stabilize yourself. Stabilize yourself, and with the ankle weight on, what you do, lift and down. Okay, notice again how the foot is pulled up, tighten this muscle, and back down. Again, this is a control movement, it is not ballistic like this. Okay, that is just going to lead to injury. Again, up and up. Very controlled. So the next exercise is going to target the calf muscle. So what you do is a tiptoe exercise. Stabilize yourself against a table or bed or wall. And then tiptoe up and down, controlled. Tiptoe up and down and control. Up again, flex the calf muscles and up. Great. So that will exercise the calf muscles. Also important in treating knee arthritis because this also leads to a strengthening of the knee joint. The reverse of that, you're going to target the anterior tibialis muscle. That's right here. Okay. Now the anterior tibialis muscle. Stabilize yourself again, and you bring the toes up and down, up and down, up. Hold it down. Control. So that is going to target what we will call the shin muscle or the anterior tibialis muscle, also important in the treatment of knee arthritis. So for the anterior tibialis, another exercise can be done. It can be done with this bar. So this bar here, you attach weight and you attach it to your foot to do the anterior tibialis exercise. I will demonstrate. So what you do here, put some weights, and there's the collar, put it on. Good. Then put it on the floor. This there. Put it in your feet. Good. Right. So now, here's what you do. Let the foot drop. Straighten the legs and up. By doing that, you are now targeting the anterior tibialis or the shin muscle. Gentle, controlled, up and down. Controlled, up and down. There, additionally as well, this can be used to exercise the quadricep muscles. Up, gentle down, up, gentle down. Okay, so again, for knee rehabilitation, a big part of knee rehabilitation is strengthening the muscles that stabilize the knee joint. If you're having knee arthritis, a very simple exercise you can do are leg swings. By sitting on the edge of a bed or the edge of a table, sturdy table, and allowing the legs to hang, what happens is gravity pull the legs down, and that puts some mild strain here on the ligaments, which can lead to a strengthening of the ligaments over time. What you can also do when you're sitting like this, gentle swings, gentle swings. Do it for around 10 to 15 minutes at a time. Listen to some music, watch some TV, gentle swings. Okay, this can also help with the mobilization of the knee joint, because in arthritis, the knee joint may become stiff because maybe you're not moving as much as you could or would like to. Another great device for knee rehabilitation, of course, is the exercise bike. That is great because the exercise bike can help you to mobilize the knee joint. You can add resistance. There's normally a dial or a knob on the exercise bike that you can turn to increase the resistance as time goes by. So that's a great way to progressively overload the muscles that stabilize the knee joint. Okay, so if you have a bike, great. Also use that as well. If you're having any trouble with knee rehab, knee pain, you can always check us here at Progressive Health Services in Chincuna Road in Cunupia, and we'll be glad to help. If you have any x-rays, WhatsApp the x-ray pics to 709-1980. Any MRI reports as well, you can send that to us. We'll take a look at it and take it from there.